We all experience anxiety sometimes. It's that feeling of worry, nervousness, or unease we get before a big test or an important meeting. This is normal stress, a natural reaction to challenging situations. However, when these feelings are intense, persistent, and begin interfering with your daily life, it may be a sign of an anxiety disorder. Unlike everyday stress, anxiety disorders involve excessive fear and worry that don't go away easily. Imagine feeling overwhelmed by fear at the thought of attending a social event, avoiding public places due to panic attacks, or constantly worrying about things that are unlikely to happen. These are just a few examples of how anxiety disorders can impact individuals. Living with an anxiety disorder can be incredibly challenging, affecting work, school, relationships, and overall well-being. It's crucial to remember that anxiety disorders are real medical conditions, and seeking help is essential. Anxiety disorders are like a family, each member with their own characteristics and challenges. Let's meet some of the most common ones. Separation anxiety disorder. Primarily affecting children, this disorder involves intense fear or anxiety when separated from attachment figures like parents or caregivers. Children might cling to their loved ones, worry excessively about their safety, or experience physical symptoms like stomach aches or headaches when separated. Selective mutism. This disorder prevents children from speaking in certain social situations like at school or with unfamiliar people despite having normal language abilities in other settings. This silence stems from intense anxiety and fear of social interaction. Specific phobia. This involves an intense irrational fear of a specific object or situation like spiders, heights, or flying. People with specific phobias go to great lengths to avoid their triggers even if it disrupts their lives. Social anxiety disorder. Individuals with this disorder experience intense fear or anxiety in social situations, worried about being judged, humiliated, or rejected by others. They might avoid social gatherings, public speaking, or even everyday interactions like making eye contact. Panic disorder. This disorder is characterized by recurring, unexpected panic attacks. These are sudden episodes of intense fear accompanied by physical symptoms like a racing heart, sweating, dizziness, and difficulty breathing. The fear of having another attack can lead to avoidance behaviors and significant distress. Agoraphobia, often linked to panic disorder. Agoraphobia involves fear and avoidance of situations where escape might be difficult or help unavailable, like public transportation, open spaces, or crowds. People with agoraphobia may become homebound, severely limiting their lives. Generalized anxiety disorder. This disorder involves chronic, excessive worry about various aspects of life, such as work, health, finances, or relationships. The worry feels uncontrollable and is accompanied by physical symptoms like fatigue, muscle tension, difficulty concentrating, and sleep problems. Recognizing the symptoms of anxiety disorders is crucial for seeking timely intervention. While specific symptoms vary depending on the type of disorder, some common signs include physical racing or pounding heart, palpitations, shortness of breath, chest pain, sweating, trembling, dizziness, nausea, stomach upset, muscle tension, headaches, fatigue, and sleep problems, emotional excessive worry, fear, nervousness, apprehension, feeling restless or on edge, difficulty relaxing, feeling overwhelmed or out of control, having a sense of impending danger or doom. Behavioral. Avoiding certain situations or activities, seeking constant reassurance, withdrawing from social interactions, having difficulty concentrating, being easily startled, experiencing panic attacks. While the exact causes of anxiety disorders are complex and multifaceted, several factors can increase the likelihood of developing these conditions. Genetics research suggests that anxiety disorders can run in families, indicating a genetic predisposition. Brain chemistry imbalances in certain brain chemicals, such as neurotransmitters like serotonin, norepinephrine, and GABA, are thought to play a role in anxiety disorders. Personality traits. Individuals with certain personality traits, such as being more prone to negativity, perfectionism, or having a low tolerance for uncertainty, might be more susceptible to anxiety disorders. Life experiences. Traumatic events, chronic stress, childhood adversity, or significant life changes can trigger or worsen anxiety disorders. Medical conditions. Some medical conditions, such as thyroid problems, heart disease, or chronic pain, can cause anxiety or worsen existing symptoms. Anxiety disorders often co-occur with other mental health conditions, creating a complex web of challenges for individuals. Depression. Anxiety and depression frequently go hand in hand. The constant worry and negative thoughts associated with anxiety can contribute to feelings of sadness, hopelessness, and loss of interest in activities. Obsessive-compulsive disorder, or OCD. While OCD is a distinct disorder, it shares similarities with anxiety disorders. Obsessions, which are intrusive and unwanted thoughts, can trigger anxiety, while compulsions, which are repetitive behaviors, are often performed to reduce anxiety. Post-traumatic stress disorder, or PTSD. Experiencing or witnessing a traumatic event can lead to PTSD, characterized by flashbacks, nightmares, avoidance behaviors, and hypervigilance. Anxiety is a prominent symptom of PTSD. Substance abuse. Individuals with anxiety disorders may sometimes turn to alcohol or drugs as a way to cope with their symptoms. However, substance abuse can worsen anxiety in the long run and lead to addiction. Early diagnosis and treatment of anxiety disorders are crucial for several reasons. Studies show that individuals who received early intervention for anxiety disorders have better treatment outcomes and are more likely to experience long-term recovery. Untreated anxiety disorders can significantly impact various aspects of life, including work, relationships, education, and overall well-being. Early treatment can minimize these negative consequences. Untreated anxiety disorders can also increase the risk of developing other mental health conditions, such as depression, substance abuse, and suicidal thoughts or behaviors. Early intervention can help prevent these complications. Seeking help is not a sign of weakness, it's a courageous step towards reclaiming your life from anxiety. Here's how to get started. Talk to your doctor. Your primary care physician can assess your symptoms, rule out any underlying medical conditions, and refer you to a mental health professional. Contact a mental health professional. Psychiatrists, psychologists, and therapists are trained to diagnose and treat anxiety disorders. They can provide therapy, medication management, or a combination of both. Reach out to support groups. Connecting with others who understand your struggles can provide invaluable support and reduce feelings of isolation. Effective treatment for anxiety disorders typically involves a combination of therapy and medication. Cognitive behavioral therapy, or CBT, is considered the gold standard for treating anxiety disorders. CBT helps individuals identify and change negative thought patterns and behaviors that contribute to their anxiety. Other therapy approaches, such as exposure therapy and acceptance and commitment therapy, or ACT, can also be helpful. Antidepressants, such as selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, or SNRIs, are commonly prescribed to manage anxiety symptoms. In some cases, anti-anxiety medications like benzodiazepines may be used for short-term relief. Living with an anxiety disorder can be incredibly challenging, but it's essential to remember that you are not alone. Millions of people worldwide experience anxiety disorders, and with the right support and treatment, recovery is possible. Remember that seeking help is a sign of strength, not weakness. By taking that first step toward recovery, you are taking control of your mental health and paving the way for a brighter future.